Welcome back. I'm Dr. Stanford Owen with PrescriptFit Medical Nutrition Therapy. Now, hopefully you're sitting there with your counselor at your physician's office, or if you're at home, first fill out your medical nutrition therapy follow-up sheet. Fill out your name, the diet strategy that you're following, any medications that you're taking. Now, you may have noticed after phase 1 or phase 2, you may have diminished medications. Don't relist the medications that you've already discontinued. We track that for you. The exercise that you're planning this week, discuss with your family how the diet strategy is affecting them. Get their input, ask their input. Environmental cleanup, can you get the pork, beef, dairy, and starches out of the house? Each week I'll be asking you to do that over and over again. Your symptoms, now you're in phase 3, note on your 8 cardinal symptoms how much those have improved. Phase 1 they should have improved some, phase 2 even more, and now you're starting phase 3. See if any of those symptoms start to relapse if you add a food group back in. And number 4, any measures that are necessary for your provider to follow on your medical conditions. Any medications that may have been added or deleted as far as appetite or hunger down at the bottom of the sheet. Number 2, you're starting phase 3. So in your calendar workbook, if you're 3, 7, or 14 days, place in that phase 3 for that number of days that you anticipate continuing. Remember that if you're choosing an aggressive, rapid weight loss, rapid disease control 14-day schedule, and you're into it for 10 days, and you can't take it anymore, boom, you jump to the next phase. And we'll discuss that next week. But you can always jump ahead if you find yourself struggling along. Now, phase 3 is poultry. For the most part, poultry is chicken and turkey, but it also includes duck and quail and emu and any other type of bird that you can find and is available, and you know how to prepare. A duck is a little fatty, so you really want to cook that down and cook that off. And then you have the skin of the turkey and of the poultry, of the chicken, which can also be fatty. Try and cook that down, remove the skin if possible. But if you really are one of those people who just feels like you have to have the skin on, just cook it down and make it crisp and don't sweat it, okay? Now, for both seafood and for poultry, fried foods pushes it into the splurge category. Why? Because the meat of seafood and the meat of poultry can capture fat as you fry it, and it's also breaded with starch. So now you have a fat and a starch, which is the toxic duo that causes most of the diseases we have to treat. But the meat of the poultry, the meat of the seafood, from our perspective, perfect nutrition. So all you can eat poultry, all you can eat seafood, and at least 8 doses of PrescriptFit every single day. And we'll see you in phase 4.